KPOA 93.5 FM as we take to the phone line like we do every Thursday morning with one of our health professionals from Maui Health. And we want to say good morning to Dr. Warren Ayers, orthopedic surgeon and the hospital chief of staff. Good morning, doctor.
Morning. How you doing?
Good. Thank you, Dr. Ayers, for calling us. Joint replacement. Is joint replacement surgery similar to a hip surgery?
Well, that's a great question. If you don't mind, if I can just quickly give a shout-out for Happy Doctors Day this coming Saturday for all the people across the nation that take care of people. I want to thank all the doctors I can, but that's a great question. So hip surgery is a very broad, I would say, topic. It could be anything from spine problems to SI joint problems to hernias to lots of different things. But joint replacement surgery in the hip just refers to removing the actual joint and replacing it with steel, plastic, ceramic combinations like that.
Dr. Ayers, how would I know if I needed joint replacement surgery or if there are other ways to heal? How would I know that?
Well, normally you're going to have a lot of pain in the hip joint, and you'd probably see your family doctor, and he would examine you and decide, is it really related to the hip joint, or is there some other problem that's referred to the hip joint? Usually x-rays would be taken, and if they see that your hip joint is starting to look bone to bone or the cartilage is gone, there's some significant spurring around it, and your motion is gone, that's when they might think that you would be a candidate for hip replacement surgery.
Yeah. My mother actually about a year or two ago had a hip surgery. Not sure exactly what was the procedure that happened, but it was a big task, and she actually had to go twice.
Oh, that's not good.
Yeah.
I think it's nice to get it done once. I mean, we spend a lot of time, I think, trying to get people so-called optimized, which would mean, when you see somebody, you try to do all the conservative things first, physical therapy, maybe injections, possibly medications, different things you can do to try to get people by, especially muscle strength. You can get people to lose some weight, get their muscles stronger. A lot of times that'll make the joint feel a lot better. But, it takes, I think, a lot of care to get somebody really in good shape to do well in a hip surgery. I think you need to go to physical therapy ahead of time, get stronger, get ready for that surgery. And sometimes when they go to therapy ahead of time, they come back and say, you know what, I don't feel so bad. Maybe I don't need that joint surgery. Staying
proactive and healthy is definitely a important thing. Doctor, how long does it take to recover from joint replacement surgery?
Again, I think it has a lot to do with how much you do ahead of time to get in shape for it.
Yeah.
If you go to therapy before and really work it hard at getting muscles in shape, getting your strength up, getting ready for the surgery, then you'll do well. I think on the average it takes about 6 or 8 weeks after a total knee or a total hip to feel pretty good, about 3 to 4 months to be starting to feel pretty great, especially with a hip. Hips do really well. The majority, I would say 97% of people get a total hip are happy. For a total knee, it's about 80% are happy. But if you get ready and you do all those things ahead of time, at about, say, 4 to 6 months, you're feeling really pretty great. By 9 to 10 months, you're getting all your balance, coordination, and strength back. And usually by a year, maybe a year and a half at the most, you're back to normal. But a lot of people can return to work, pretty close to, depending on your type of work, 6 to 12 weeks after surgery.
Got it. Well, my mom is doing fine now, and I thank the doctor that did her surgery as we are celebrating the doctors this Saturday. Dr. Warren Ayers, orthopedic surgeon, chief of staff at the hospital. Thank you, my friend, for calling us this morning.
All right. Thank you.
Aloha.